Hi, I'm Dr. Corkins. I want to take a couple minutes to explain an unrecognized problem that occurs with whiplash. And it has to do with the upper cervical spine. In 2002, in the Journal of Neurological Science, they published that 97% of whiplash patients suffer from alar and accessory ligament damage. As I talk to attorneys and sometimes other doctors, I find that they don't know where these ligaments are. I want to take a couple minutes and show you exactly where they are. I have here a model of the upper cervical spine. This would be the head, and down here would be the lower neck. And if you could zoom in here, I'll zoom in. I'm going to turn it around. I want to show you that these blue representations here represent the alar ligament, and what it does, it connects the dens of C2 to the bottom of the skull, the condyle at the bottom of the skull. And the purpose of those ligaments is to stop the rotation of our head. If you turn your head to the left or right, eventually it stops. It stops because of these ligaments. This brown ligament that you see here, that's the transverse ligament. Sometimes that gets damaged as well, but more importantly, deep down in here is the accessory ligament. That gets damaged. Now what happens, these ligaments are there for stability, and you can see that in just this model I have lots of stability. And here's a model that is completely without those ligaments. And without those ligaments, you can see there's no stability. And if you look right here into the front of this, if you could zoom in on that, this will be an image that I show you using digital motion x-ray, and I have people laterally flex to the left or the right, and when they do that, you'll see that C1 here will fall off, this edge here will fall off several millimeters, and then we go to the other side, this falls off, and that is an indication that these ligaments have been damaged. So here we go. Alar and accessory ligament damage. If you attorneys want to improve your settlement value, I would learn these ligaments and get a DMX and send that to the adjuster. There's no way they can fight it. Thank you.
Let me show you what this looks like when we see a motion x-ray. So here's case 1, and you'll see on the first repetition when the patient laterally flexes to his right that we have a normal alignment between C1 and C2. When he flexes to the left, you see an overhang of 6.9 millimeters. This is our first repetition. We're going to have the patient move back to the right again, and again we get a normal alignment. When there's a flexion back to the left, we're seeing 7.8 millimeters. In other words, it moved a little bit more. On the third repetition, when the patient moved to the right, we were surprised to see that the alignment actually now extended 5 millimeters of C1 out over C2. And to the left, it increased to 10.2 millimeters. This is severe damage, and we actually did one more, 6.9 millimeters to the right and 11.1 millimeters to the left. Again, this is alar and accessory ligament damage. And now let's look at case 2. Motion to the right, we begin to see a fall off of, looks like 6.8 millimeters. To the left, the alignment is 6.2 millimeters. Back to the right again, it looks like 8.2 millimeters there. Back to the left again, C1 falls off C2, a total of 6.7 millimeters. So this person is experiencing, as a result of the whiplash, alar and accessory ligament damage. Now to the left again, 9.7 millimeters. These patients suffer from severe headaches, episodes of vertigo, sleep disorders, neck pain, and spasm. So if you've been involved in an accident, get yourself checked out by calling the Advanced Spine Center at 561-433-4184.